Hello guys, very interesting topic and very important subject in the medical field, which is known as anatomy. We will complete our anatomy soon. So let's talk about vertebral column. Vertebral column, it's looking like worms. The worms which is present in human body, the worms that are present in animals, they can cause problem in the tissues because every time they suck the blood, the fluid which is present in the tissues, because they need energy for their life. So leave that matter, come here in this point. We have a vertebral column. In the vertebral column we have spinal cord, spinal cord actually have a fluid. What they have? Fluid. And this fluid have some neurons, which is interneuron, motor neuron, mixed neuron. So leave this matter. Which type of neuron? Come here, the part of the vertebral column. Vertebral column have 5 parts. One part is cervical region. We say that it is cervical curve. The second part, which is thorax, or we say that it is thoracic region or thoracic curve. And the third one known as lumbar region. Fourth known as sacrum and coccyx. Actually, these 5 parts have pairs. What they have? Pairs. 33 vertebra present in vertebral column, and each part have their own vertebra. And cervical region have 7, thoracic have 12, lumbar have 5, vertebra, sacrum 5, coccyx the last one, which is 4. If we add all these, it totally 23 pairs. So these all regions perform important role. These all regions have nerves. What they have? They have nerves. Every part have their innervation, spinal nerves. Every part have their spinal nerves. This nerve goes into the systems. This nerve goes into our systems of the body. For example, our circulatory system, our cardiac system, our digestive system, respiratory system. Total, these nerve goes into all body. They control our body function. Sometimes our vertebral column displays from their position due to force. Yes, due to any kind of force, the position is abnormal. What happened? The movement of the body is at a normal condition. If, for example, I am moving downward, my chest downward, but it's due to the vertebral column. If I am in normal condition, my chest is in front of you, it's due to the vertebral column, because vertebral column supports the lower limb, supports the upper limb, thoracic cage, even skull, our skull. This our skull total. This for the skull. The spinal cord is in the vertebral column. The spinal nerves from vertebral column. So guys, remember these all concepts from vertebral column. Innervation goes one is known as sympathetic nervous system, parasympathetic nervous system. These two innervation, sympathetic nervous system and parasympathetic nervous system, decrease the function of the body and also increase the function of the body. For example, our blood circulatory system decrease. It's due to these two innervation. And then again it suddenly increase. We use some kind of drugs and blood pressure increase as in normal condition. So these are all information for you. We have a vertebral column divided into 5 regions. One is cervical, other is thoracic, lumbar, sacrum, and coccyx. These structural which is the body pillar, known as pillar of the body, and that supports the upper limb, that's for the lower limb, that's for the skull, that's for the thoracic region, thoracic cage also, and that supports the spinal cord which is present inside the vertebral column, and that supports the spinal nerves that surrounded all our human body. Obviously, the vertebral column helpful for movement of human body. If we are moving upward direction, if we are moving downward direction, if we are moving in any direction, it's due to the vertebral column. If you have defect in vertebral column, it is impossible to survive is in normal condition.